Good afternoon. I want to thank everybody for being here. Today I am Dr. Marcia Adams. I'm the new Dean of the College of Nursing here at the University of Alabama in Huntsville. And we are thrilled today to be able to talk to you about the importance of the Center for Aging and a very new initiative that is taking place. You know, in nursing today, with the future of nursing and the Affordable Care Act, it's imperative that nurses, nurse practitioners, advanced practice nurses are at the forefront for caring for the older adult. And so UAH College of Nursing is very proud to partner with Dr. Khan on this initiative related to research based on fall prevention. And so I will turn it over to Dr. Khan.
I'm by profession a physician, but trained for the last 30 years in geriatric medicine from various countries of the world, including the University of London and the United States. And for the last 34 years, I've been doing only geriatric medicine, which means that we are dealing with patients above the age of 70. And I came to Huntsville 18 years ago and have established a practice which deals with the aging problems. I have noticed that majority of the patients are getting inappropriate medications, which they should not get, and they are having problems that are not being dealt with because of a lack of training in this particular specialty. And no one is to blame. It is that we have now faced with a sudden surge of people above the age of 70. So this aging of America has brought new challenge. And with that challenge, an opportunity, like we have today, to help the people who brought us in this world. So having said that, one of the giant problems of aging is falling. A lot of people think that a person falls, they fall because they're ill. That is not the case. The incidence of falls in the United States at the age of 65 in community dwelling older adults is 1 in 3. That means 1 in 3 people in the United States are falling each year. And at the age of 70, it is 50%. And the direct and indirect cost for the government was more than heart disease last year. But we do not have a chapter in our book of what to do when a patient falls. So therefore, this is a great opportunity to join the future leaders of medicine in geriatrics. That's going to be the nursing program. And this gives me a great opportunity because I've been training these nurses for many years throughout my career because they are 24 hours at the bedside of the ailing patient. So therefore, in 2009, when we opened the nonprofit center, we started what we call a fall prevention program. Now, this program is not just movement. This program is based on Center for Disease Control came out with a 100-page community developing program, how to set it up. And we have the first in the country to start a community-based program. One of the important components of the program is for patients to move in a certain way. So this is not an exercise, if you look at it. This is strategic movements to retrain the aging brain. So what has happened if certain factors in like the peripheral nerves, joints, skin, and muscles have changed with age? Like, at the age of 65, your kidney and liver function is decreased by 50%, and the blood tests don't show that. So what we are doing here is the brain has 10 billion cells. So we're using strategic movements to create new pathways to the brain, the inner ear muscles, so that the brain is trained, and the reduction in falls is 70% based on international research. And so we established this community program in the churches because, the churches have a place. So because if you want a program that's to be replicable everywhere, the first place is go to the house of God. And when you have a place readily available for you, and then you have congregations, the cost is not easy, and you can get any trainer from the church. And right now we are doing in about 8 churches, and we are having consistently more than 500 people in our community for the last 5 years. And we have now opened a fall prevention clinic, one of the first in the country, as a community program, where we are going to evaluate with the School of Nursing. And it will be their program mainly. We are here to assist as a nonprofit, to disseminate knowledge so that we can take care of these people who have been left behind. And with that, I thank you very much, Mayor Battle, for coming, and thank you for giving me the opportunity.
Medicine that lets each of our citizens get a little bit more out of their life. And that's something very important when you've got citizens like we do in the area as they're aging, and as you're aging and you have that preventative medicine that teaches you how not to fall, how to have balance. I've been through his classes and looked at his classes and looked at them on a personal basis, and he does a fantastic job with our senior citizens providing a preventative form of medicine that lets them live a better quality of life. And that's one of the most important things that we can give. If we can give a better quality of life, you're going to see our community be a better place. It also gives those citizens a chance to be productive longer. And what he has done on a day-to-day basis is made sure that our daily citizens get more out of life, that our citizens who are in what I call the graying years, who I'm heading that way very quickly, are finding a little bit more out of life and being able to be productive for a lot longer. So, Dr. Khan, thank you so much for what you've done for our community.
Thanks.
My name is Dr. Karen Frith, and I'm a professor of nursing here at UAH. Being less mobile can start a cascade of problems that require medical care and can lead to loss of independence. But rather than enjoying hobbies and travel and volunteer work and time with family, older adults who fall can become fearful of leaving their homes and become isolated, alone, and depressed. But we're here today to talk about a program that will prevent these problems. I know of the consequences of falls firsthand as a nurse and as a daughter of a parent who actually fell. So I'm very passionate about the work that Dr. Khan is doing in the Center for Aging and working with my colleagues here at UAH. So I wanted to share some details about the study that we'll be conducting. Our study is designed to test a comprehensive fall prevention program that's based on the CDC, the study toolkit that's provided there, and we do assessments and interventions based on the recommendations from the CDC. So we're going to recruit participants from healthcare providers who refer them because they've had a fall in the last 12 months. And in order to qualify for the study, adults need to be over the age of 65 and, as I said, have had a fall in the past 12 months. Those participants need to be able to walk, and even participants who walk with a walker or a cane, we welcome them to our study. Participants need to be able to understand instructions and be willing to participate in some balance and strength exercises, as Dr. Khan and Mayor Battle have described. And these can be done in a class or can be done through some guided directions in the home. So if you qualify for the study, then here's what will happen. The Center for Aging is located on Franklin Street, and we will contact you after a referral is made, and then a nurse practitioner will meet you at the will be there at the first meeting, and will run through some simple tests such as sitting, standing, and walking. And then the nurse practitioner will take the medical history, and we'll go through some other tests of your thinking ability. We'll ask you questions about your mood and look at your medications and your medical history, look at your feet, test your eyes. So it's a very comprehensive assessment of the older adult. And this, of course, is discussed with Dr. Khan so that you're getting a geriatric specialist and a nurse practitioner providing this kind of assessment for you. At the first meeting, we'll also refer you to balance classes or instruct you in a way to do exercises. So if you're a member of the study, then you'll come to the Center for Aging once every 3 months for an entire year. So we are very committed to having you in the study and to improving your balance so that you'll have a healthy and independent lifestyle and avoid falls in the future. At each appointment, the nurse practitioner will ask you about your history of falls from the previous appointment. We'll test your balance and your walking, and we'll also go over the medications that you've been taking. And the goal is to reduce medications so that our goal is to get you to 4 medications or less so that those medications don't interfere with your balance and your thinking. The nurse practitioner will also make a home visit, and the purpose of the home visit is to look at your environment and make suggestions about how to improve the safety and to get those hazards out of the home. And we'll actually leave instructions for you. And I want to point out that all of the appointments are covered by Medicare and that your relationship with your primary care physician will never be disrupted. This is an additional care provided in the community for you to improve your health. I also want to talk about our collaboration with our colleagues in the College of Engineering. We have 2 professors who have developed a smartphone application here at the university, and this technology will be the first time it's used in a fall prevention study. And the technology makes very precise measurements of the angle of the body, of standing, and of time for walking. And what we'll do with these measurements is to assess the difference in a person's balance and stability each 3 months. And those very precise measurements, then we can tell you about how you're progressing in your improved balance and stability. And then we also will be able to use those to assess our program's effectiveness. So we thank them for their contributions, and we look forward to the beginning of this study, and to those of you who would be interested in participating in the study to enroll in it. So thank you.